very controversial part of the Affordable Care Act takes effect today. Starting today, insurance companies must provide free access to contraceptives for their customers. News Channel 5's Stephanie Ramirez is here now with more. And Stephanie, you were surprised by some of the responses you heard today.
That's right, Danita. Well, first, this part of the policy is brand new, and of course there are supporters and opponents. But what is more alarming, what I found to be more alarming, is that while I was out talking to folks, a lot of the people I spoke to, especially women, either had no idea what it was or didn't understand how it would affect them. It's day one of the copay and deductible-free contraceptives, one of the provisions provided in President Obama's Affordable Care Act, and supporters are calling it a victory.
You know, women got a right.
There's a lot of people that got a lot of children now, and they can afford for health insurance.
The services insurance companies must now provide without extra costs include well women visits, domestic violence screenings, and the hot ticket item, contraception, a provision the Catholic community continues to protest.
Constitutional and rights issue is what we're really dealing with here.
The act required all employers, including religious institutions, to provide contraceptives like birth control. The Obama administration added exemptions to excuse churches and similar organizations from having to provide this. But Bob Tayak with the Cleveland Diocese says the exemption will take a year to go into effect, meaning if you're a religious organization that fits the bill and doesn't provide the service, there's a fine.
It becomes the difficulty of a decision on whether you have to obey the law and go against your teachings of faith and moral.
But on the act as a whole, those with the Planned Parenthood of Greater Cleveland are calling this provision the best advance for women's health care in a generation.
There will be more than 300,000 women who will now have access to health care.
In Ohio, Celeste Ribbons from Planned Parenthood says 96% of the services the organization provides are preventative, and now those who couldn't afford this can be treated.
If people don't have access to cancer screenings, then there could be the potential for long-term effects either from cancer or some other preventable disease that could have been caught if they had preventive care.
Another thing Celeste of Planned Parenthood says is with the act, no one can be denied coverage due to pre-existing conditions. Now, the act is being appealed by various different organizations. We'll continue to keep you updated. Stephanie Ramirez, News Channel 5.